Welcome back to the EnviroHealth podcast. I'm your host, Dr. Joseph Levermore, and today I'm continuing my conversation with Dr. Gary Fuller, author of the eye-opening book, The Invisible Killer, The Rising Global Threat of Air Pollution and How We Fight Back. In the second part of our interview, we'll explore the evolution of air pollution from the days of John Owens through to the modern challenges we face today. Dr. Fuller shares insights from his groundbreaking research on air pollution and wood burning, often marketed as a green alternative, but is actually wreaking havoc in our modern cities. Dr. Gary Fuller is a clean air champion and senior lecturer in the Environmental Research Group at Imperial College London. Gary, each year, global air quality indexes reveal a disturbing pattern. Many of the world's most polluted cities are in rapidly industrialising nations, where economic development often takes precedence over environmental protection. The pursuit of growth frequently relegates clean air to a luxury rather than a necessity. Consider Lahore in Pakistan, where the Pakistan Air Quality Initiative recently reported alarming data, with the average air pollution levels have reached 108 micrograms, with smog season concentrations in November soaring to a dangerous 251 micrograms per meter cubed. Lahore's PM 2.5 levels are similar to London's at the start of the 1952 Great Smog. While not as extreme as London's peak, Lahore's air pollution is 7 times higher than the World Health Organization guidelines. In cities like New Delhi and Lahore, are we witnessing a health crisis in real time due to the air quality that citizens of these cities are forced to breathe?
Yeah, I mean, this is one of the evolutions of our knowledge of the health harms of air pollution. You know, the 1952 smog taught us and proved categorically that really short exposures to intense air pollution killed people. Yeah, we then learnt through the 1990s, through things like the Six Cities study, that air pollution over a decade, 15 years, 16 years, caused life shortening. You know, you died earlier because of it. And we can see that in our health burden estimates today, that more polluted places, we estimate that people live shorter lives and therefore the death burden is higher. But the newer evidence, I think, that's coming to the fore in the last 10 years is the way that air pollution is affecting us all the way through our lives, from before we are born through our development, you know, as fetuses, and then slowly through the development of children into adulthood, and then finally at the ends of our lives, we're seeing things like dementia and Alzheimer's coming to the fore. It's not just that air pollution is shortening our lives through a burden of chronic diseases, it's really making our lives so much worse. It's limiting the way that people can contribute to society, be it maybe going to, you know, school to be educated, the way in which they can contribute to their family life, their social life, and the way in which they can contribute to work. So there was a study published at the end of last year, which used UK Biobank, and this is about 500,000 people. It looked at the old people, which is quite distressing for me in my time, since this was defined as people over 49, and looked at the around half of them that were living with multiple long-term chronic diseases, and it found a really strong association with the air pollution that they were experiencing, having made all the adjustments for all the economic and social factors that would have determined it. And that doesn't show causality, of course, but it's a real pointer that air pollution has got impact way beyond just life shortening. Going back to the people of the 52 smog, so you asked the question about the legacy going forward, and it's a really interesting question. That is, the air pollution we're exposed to in one part of our life when we're young going to affect us later on? So there's one study done of people who were under the age of 1 at the time of the 52 smog. They compared those that were in London to those that were outside London and didn't have the smog, but they had all the other social factors. And they compared them to the people that were under 1 in the years either side. What they found was those kids that were around in the 52 smog then went on to have a 20% increased chance of having asthma as a child. And although it didn't quite reach the statistical sort of thresholds of significance, probably around a 10% extra chance of having asthma as an adult. So there's good evidence that that one sort of burst of air pollution may have affected people through the rest of their lives.
The 1952 London smog definitively proved that short-term air pollution exposure can be lethal, while research like the Six Cities study showed decade-long exposure shortens lives. Recent evidence highlights the far-reaching impact of air pollution.
A new global study of its kind has found a clear link between exposure to air pollution and developing dementia later in life.
We have to connect the dots between things that happen in our environment. We've talked about climate change and our health. And this study just out in JAMA Psychiatry is a perfect example. Looked at almost 400,000 people, followed them for about 10 years in China, and then studied air quality and their risks of certain psychological conditions, anxiety, depression being most notable, and found when they measured air quality, those who had the highest exposure to pollution where they lived also had the highest rates of depression and anxiety.
From fetal development to childhood and into old age, contributing to conditions such as dementia and significantly reducing both lifespan and quality of life. When examining these relationships, scientists must navigate complex confounding exposures like smoking. Confounding exposures are separate factors that could independently affect health outcomes and essentially mislead researchers about the true cause and effect relationship. So Gary, do these cohort studies use methodologies to address such complexity?
Yeah. The study was actually done amongst a cohort of people, so a lot was known about them. So there could have been opportunities to adjust for things like smoking and other habits. I don't know if they did, but it was a cohort study, so a lot was known about the people. But an interesting one is moving to the work here that Ian Mudway and others within Environmental Research Group has done, looking at children's lungs in London. And their work in East London, where I had a tiny part of the study, but they measured the lung function of children who were around 9 years old for 4 or 5 years consecutively. And they found that these children growing up in East London pretty much today, only a couple of years ago, are growing smaller lungs because of the air pollution that they're exposed to. And this diminution, if you like, is about the volume of 2 hen's eggs. So if you think of a child maybe in your family or a relative or in your street, a 9-year-old, and think about 2 hen's eggs, that's actually quite a large volume. And it's unknown what legacy that will cause, going back to your question, in 50, 60, 70 years' time when they're reaching the end of their lives and they get, let's say, pneumonia or flu or something like that.
So it's not only exposure to 800 micrograms of annual air pollution that impacts us, it's also 20 micrograms, right?
Undoubtedly. And I suppose that's another part of the evolution of our knowledge of air pollution. When I started out in this, there was very much the concept that we could set limit values, which would be policy things, and government had a committee for doing this called EPACs that actually set out limits for policy. And there was a concept that below these limits the harm would be small, almost it was like a safe threshold. But so many of the studies that happened in the last 10 odd years really point to the fact that there is no discernible threshold, which is why the World Health Organization changed their guidelines in the way that they did just over a year ago.
And how have they changed their guidelines?
Yeah, so it's an interesting question, I suppose, from a science perspective of how you set a guideline for something when there's no apparent sort of safe or zero effects threshold. And I thought that the scientists at WHO did a really good job of this. So they looked at all of the studies they had out there that had shown effects, and they said, well, we're going to we probably can't set it at the absolute minimum, but we're going to set it at about the 5th percentile. And that's interesting from two perspectives. One, it enables them to say, what should we be aiming at, which is the purpose of the WHO guidelines. And the other one is interesting pushback from policymakers and politicians when they say, look, you've set this guideline, it's completely unachievable, etc., which we hear quite a lot. And the pushback is, no, it is achievable. It has been measured in these places. It does exist in this study, etc., etc. So I think the WHO did a very smart move there in making sure that its guidelines still remain relevant.
By applying a 5% threshold to the studies that they identified, is that a typical way of legislating for an environmental pollutant, or is that the first time?
I'd bow to people that have got greater knowledge of these things, but I thought it was quite innovative to do this. And the previous ways to do it have been to try to look for evidence of kind of like no effect. And so it's a really quite different mapping of the problem, and quite an important one, but one to which policymakers and politicians aren't really responding. The guidelines have been out there now for, well, certainly more than a year, haven't they? And we're not seeing really things from governments that are saying, okay, we're where we are today, and what should be our pathway to get to the WHO guidelines. We're not seeing that work being done. What sources would we have to change? How would, in terms of the emissions that we create, what new sources will we have to start regulating that we don't regulate at the moment? And policymakers just aren't creating these pathways, and I think it's something we're missing.
Our understanding has evolved dramatically, from setting safe thresholds to recognizing there is no level of air pollution that is harmless.
Scientists have confirmed that today's major air pollution, the air that millions of people in cities breathe, is cancer-causing. The World Health Organization agency said this is the first time it has evaluated the whole mixture of air rather than focus on specific air pollutants. The conclusions apply to all regions of the world.
Leading the World Health Organization to revise their guidelines and using an innovative fifth percentile approach that provides ambitious yet achievable targets despite government inaction. Gary, looking at the potential conflicts in environmental policy, how can we reconcile the tension between promoting wood as a renewable resource to reduce carbon emissions while acknowledging its significant contribution to air pollution, particularly in urban areas like London?
I think that's a really interesting and big topic area. The growth of, or the return, let's say, to the use of solid fuel to heat homes is a line that connects us from the air pollution we have today to what we had in the 1950s as a solid fuel issue. There are many people that struggle to see that just 8% of homes in the UK are producing more primary particle pollution than all of the vehicles on the road. But it was actually similar in the 1950s. Even though just a small percentage of coal was being used to heat people's homes, this was responsible for about 60% of the wintertime emissions. So the mapping today and framing of the problem, we can learn a lot from the 1950s. Then you talked about climate, and you kind of put it up that there is this, if you like, balancing for the use of wood, saying, it's a trade-off between a carbon and climate emergency benefit and an air pollution disbenefit. Well, in fact, it's bad for both. If you burn a piece of wood, you'll produce a lot more carbon for the same amount of heat than you do from burning a fossil fuel. That's because wood contains moisture. It's a natural product. It's not like burning the near charcoal of coal or the near pure methane of fossil gas. So if you sit in front of the fire in your home, as opposed in front of a wood fire, for instance, then there will be more carbon in the atmosphere at the end of the evening than there would have been if you had heated your home using a fossil fuel. So the carbon neutrality really relies on the system's capacity in terms of forestry to reabsorb that. And it's certain that this takes decades. If we look at chopping down really mature forest and then setting fire to that, then the payback time in terms of climate neutrality could be more than 100 years. And, you know, it seems absolutely ridiculous that we're going to save the planet by burning the trees. No, we're not. We have to be reframing wood burning. It's almost certain it's bad for climate in a few decade time frame. It's terrible for air pollution. And I wonder what it's actually doing for our biodiversity emergency. There was a study done in France that said, how can we source more of the wood that we're burning from domestic sources? And they come up with a number of scenarios. One really was, we should have planned for this about 60 years ago and planted the trees then. Obviously that didn't happen. The other one is to take ancient woodlands or really old woodlands and start chopping them down, bringing them into production. Or to increase production now, what we can actually do will be to chop down trees before they reach maturity. Yeah? Either way, all of these are harmful for the total carbon that's stored in our biosphere. And if it comes to doing things with woodlands, you know, that we would have otherwise left untouched, then it's going to be pretty bad for our biodiversity as well.
I think it's important to note, though, that I think there has been an issue of messaging with regards to solid fuel burning in the home. So, for example, my mother, who is very much a climate activist, to at every opportunity within her budget constraints to live a greener lifestyle, but has very much bought into the use of wood to heat her front living room or front room at home. I mean, I'll go home every now and then and I say, Mom, that's actually not as green as you think it is. But I do think there is a messaging issue.
Yeah, I think you're right. People perceive wood as being a natural fuel and therefore it must be benign, it must be harmless, and that's really not the case. How this actually works depends on where you get your wood from. Another interesting dimension of this is the enormous cost pressures that people have not only felt themselves, but really been under through the last winter. And how do you afford to heat your home? Anya, one of our colleagues here, has measurements from London this winter. And one of the things we've seen is that at the times people are burning wood, and we can see chemicals from the burning of wood in the atmosphere, what we're also seeing is arsenic. And this is arsenic in the same sense as the Agatha Christie books. And the arsenic is coming from the fact that people are burning waste construction wood. And up until about 10 years ago, wood used in building homes and so forth was impregnated with arsenic to stop it rotting, basically, and to stop the attack of like wood-boring insects. When you set fire to that wood, the arsenic just goes up the chimney. There are communities small communities in rural places in New Zealand, for instance, where there is so much burning of waste construction wood that were it to be in Europe or the UK, the air pollution would be illegal because of the arsenic in the air. It's a known carcinogen in terms of its long-term exposure. So there's a lot of really quite, I suppose, difficult mapping and ways in which we need to rethink about wood. You know, burning construction wood, for instance, it's not good for climate. It's certainly not good for air pollution.
But that isn't an issue with regards to the end individual that's making the decision to heat their homes with fuel or with wood. If your budget allows only for the access to said fuel, then whose priority is it to make sure that you as an individual is protected from arsenic exposure from burning fuels that are in your budget?
Yeah, I think it's really, really tough. And there's people that have no choice at the moment. There's people that have really struggled to keep warm most winters, and especially in the last winter. If you live in a rural area off of the fossil gas grid and you're reliant on heating oil, for instance, then you've been under some cost pressures for really quite a few years now, because you're in competition for your fuel with diesel fuel, for instance. And that makes it really difficult. And this is one of the, I suppose, challenges in communicating this. As scientists, we look at epidemiology, and there's a focus there kind of on the average person or the average risk. And there are differences about this. And I think it's really difficult how we speak to people that really don't have a choice. Throughout the whole air pollution sort of debate, in the UK, we're almost blind to issues of inequalities. And that's inequalities from ethnicity, that's inequalities from wealth, and that's inequalities in people's vulnerabilities and in health status and condition. And we don't talk about that nearly enough. So there's a real environmental justice angle here, which we're almost blind to in the UK.
And with regards to the environmental injustice regarding air pollution, would you be able to talk about any of the particular nuances in society that you would say that these individuals are underserved?
Yeah, I'm not sure it's underserved, but there is some real disparities in the UK. Let's say that look at transport, for instance, and we know that people who are poorer own fewer cars, and there's a large number that don't have access to a car. But if you look at the locations where we have the greatest transport air pollution, it's where the poorest people live. So largely what happens is people are coming from more wealthier areas and driving in the areas where the poorer people are living. So there's a real environmental justice angle here. There was a study that was done that looked at the first decade of this century, and it found that when it comes to transport air pollution during that decade, the disparity between the transport air pollution that's experienced by the wealthiest and the poorest actually got wider. So it wasn't something that, is not a great success story. And that's why I think we need to be building inequalities a lot more into our thinking.
In our lived memory, the best known case supporting the environmental injustice of air pollution is the case of Ella Kissi-Debra.
Ella Kissi-Debra was just 9 years old when she died following a severe asthma attack. She lived just metres from the South Circular in Lewisham, one of London's busiest roads. But a 2014 inquest didn't consider the role exposure to pollution played. Ella's mother, Rosamond, fought for a new inquest to be held, and in a landmark case in December, a coroner ruled that excessive air pollution contributed to Ella's death.
That was Cathy Newman's report on Ella's tragic case. It wasn't until after the first inquest that her mother, Rosamond, with the support of others and her legal team, discovered that air pollution was responsible for her daughter's death.
Her lawyer, Jocelyn Coburn, she was looking for people who had been impacted by air pollution, and I can remember going into her office and saying to her, I think I might have something for you. I don't know, but this is what I have been told. And that's how it started. And I always give credit to Jocelyn. So what she did, basically, I mean, it's such a genius thing she did now when I think about it, but very simple. She basically outlined on a graph all the times Ella had been admitted to hospital, so just before she went in, and then she got the data from the monitors near the house, and you could always see just before there was a spike in air pollution, Ella would go down, and we then found out that happened 27 out of 28 times.
Can low and ultra-low emission zones serve as a safeguard to prevent tragedies like Ella's from happening again in the fight against these environmental inequities?
Yeah, it's interesting. We've been doing ultra-low emission zones in Europe for more than 20 years. If you look at the one in Berlin, it's been going for a very long time. We've had a low emission zone in London since 2008, although it hasn't really applied to private vehicles. So the ultra-low emission zone is kind of a strengthening of the low emission zones that we've had. And for those people not so familiar with them, what they're trying to do is exclude the most polluting vehicles from our streets. And this mainly means the oldest vehicles and especially the oldest diesel vehicles. So how well has it worked? The ultra low emission zone in London has worked astonishingly well. Before it was implemented, Anna Font and I, with some collaborators in Paris, did a study, and we looked at the rate of progress towards meeting limit values for nitrogen dioxide in London. We looked between 2010 and 2016. Would you like to have a punt at, based on that rate of progress, how long did we predict it would take London to meet the levels that were set in 1999 and should have been met in 2010? Do you want to have a go?
I'm going to go outrageous. 150 years?
Do you think that's outrageous?
It could be worse.
It was 193. So, something clearly had to be done. We needed a game changer. The ultra low emission zone, when it was brought in London, was in central London as astonishingly effective. So before this, we had roads that were 2 and approaching 3 times the legal limits, and with reduced concentrations on average in roads in the central area by around 44% before COVID hit. And a lot of that change happened before the actual charging regime started, as people upgraded their fleets. You can't expect people to change their vehicles suddenly on day one. And there was a big sort of build up to it over a couple of years. It was then rolled out into inner London, and the improvement there has been smaller, partly maybe because the benefits of the central London zone had actually already spread to some extent. But we then saw in inner London an improvement in nitrogen dioxide of around 21-22% alongside the major roads. Now, what would have happened, the big question is, what would have happened if we'd had no ULEZ? And I reviewed the work that's been done for Transport for London in assessing this, and one of the things that's really keen that we put in there, which they were keen as well actually, was to have kind of a counterfactual of what would have happened if we'd had no ULEZ. And so what we did was we looked at the very slow progress that was being made in improving air pollution in outer London, and used that as a more or less counterfactual. If inner London and central London had improved at the same rate, then what would we have expected? And that's where this 41%, this 44 and 21% comes from. It's a comparison of what we actually achieved on the streets of central and inner London compared to what we think we would have done without the policy in place.
So the fresh out of uni physicist Gary Fuller left physics because he didn't want to model, and used his skills to model the 40% or the 44%.
Oh yeah. I don't do modelling that much. In fact, we haven't really talked about most of the things I've done for the intervening 30 odd years. We've been talking a lot more in the history and a lot more in the policy domain and a lot more in the emerging evidence on health effects. But I've spent most of that intervening 30 odd years since I arrived on a 2-week contract measuring air pollution, and it's been really good. And I'm so privileged to have worked with some really great measurement scientists, and measurement in itself, if you like, is either I don't know, I wouldn't say a science or a craft, let's say. I wouldn't call it an art. It's a craft, and it's been really good to explore that and to also kind of push back some of the methodological knowledge during that time. Also, I suppose I have done a little bit of modelling in that the models I do aren't the ones that predict air pollution, so they won't draw you a pretty map or anything like that, but they do help you interpret sources. So that's a different type of modelling. But yeah, I like the irony. But I have managed to bring the physics that I learned and experienced, I suppose, in my undergraduate days into that measurement science. And maybe without that physics training, I would have looked at these questions a lot differently.
So on the 44% in comparison to the 20 to 20 or 21 to 22%, did you look at this from a health outcome perspective in terms of attributable years of life lost?
I certainly haven't done, and I think that that's work that, as best say, is underway. So you need firstly to think the low emission zones and ultra low emission zones, they're tackling traffic pollution. So the greatest benefits will be arising for the people that spend time close to and on roads. So that's the people that live there, as well as us when we go about our daily lives travelling around in those transport environments. And I know there's work underway to actually try to therefore quantify what that benefit would have been, since it's not just arising for the people that live alongside major roads, it's those, the kids that go to school by walking along them. It's you or I when we've perhaps come here on the bus or cycle to work. So it's a complicated picture, but I think there'll be some interesting answers.
With these dramatic figures of essentially the successes of policy intervention in mitigating air pollution, is there anything else that you personally would focus on to reduce individuals' exposure from an outdoor perspective?
I think the big lesson really comes from looking back at air pollution, over the last 70 odd years. Why on earth, Joseph, are you and I still working in this field of science when 70 odd years ago we knew it was harmful? Why haven't we solved this problem? And I think we really have to ask ourselves this question. One answer that I'll offer, and one that I put through my book, was that our policies tend to look at pollutants just one at a time, or one source at a time. So, for instance, 1952, we dealt with the smoke that was coming mainly from people's homes and also from factories. We did nothing about the sulphur that was coming from burning coal and oil. That led to the acid rain problems of the 1970s and 80s. Then we turned attention to industrial pollution, and there's a lot of papers at that time that were saying, what about transport? This is a bit of an issue. But policymakers really weren't that interested. Then they got on to transport, and now that's the main focus. You asked about the ULEZ. That's the main focus of debate. I'm sure if you were to ask anyone about air pollution, in a conversation, it would take them about 15 seconds to point to the nearest busy road and some bit of diesel traffic. What they won't point to is all the other sources that we need to consider if we are really to make, significant progress on this problem. So, for instance, agriculture, a huge amount of the particle pollution we experience in Europe, especially in springtime, is because of the interaction of agricultural ammonia and industrial and transport pollutants. There is the plastics, for instance, from tyre wear, from road wear, and those types of particles that are entering our air. And there's also huge changes in the pollutants that we create actually inside our home, the use of solvents. So ozone, summertime ozone, if you're looking across the US and almost certainly across Europe as well, almost the majority of the precursors for those types of summertime smog are coming from the products we're using in our home, and not from industry and not from petrochemicals as they used to.
Throughout our discussion, we've highlighted several key challenges in addressing air pollution, from media coverage to political responses. Given what we've gathered, how do you think the fragmented messaging around air pollution in the media, combined with the political focus on simplistic solutions like green walls, impacts public understanding and the effectiveness of addressing the broader issue of air pollution?
I think there's two parts to it. Yes, one, I think it is a messaging issue. If you go and look about the way air pollution is reported in the media, you'll see all of these individual news stories out there, be it that air pollution causes dementia, be it air pollution is causing our children to develop smaller lungs, and there's no cohesive narrative that draws all these together. And you'll also probably see some things about air pollution, different air pollution sources. You'll see wood burning, you'll see transport talked about, and probably industry. But there's nothing that actually brings it together to create a whole picture, which is why, as another plug, that's the reason I wrote my book, was to try to draw all of these together. You asked another part of your question, for which you posed, it wasn't really a communications issue. Oh yes, the other part of it is that perhaps there's a limited political bandwidth. So, for instance, a lot of people have proposed solutions that try to clean up our outdoor air. And these are really attractive to policymakers because you don't really have to ask people to do very much. So I'm thinking things like green walls that are being planted around things, or paints and coatings that, you know, try to react away the air pollution and work well in the lab, but whether they work in the real world, you know, is a question of physics, not chemistry. So I once met a politician, an MP from West London, and we were part of a large group trying to talk to her about the effects of traffic pollution. And her response was, why are you telling me I need to do all of these really difficult things about people driving and how I'm going to communicate that, when I went to the opening of a green wall at a primary school in my constituency just the other day? And this is protecting the children from air pollution. Why are you telling me I need to do all these things to do with cars? And I looked at this green wall that was put there, and it's about the size of the hedge that my nan had in her front garden. And there's no way that this was doing anything to protect the children. But because so much political capital and bandwidth had been expended on it, she thought it was the solution. So I think we also need to frame it differently. We need to start from the outset rather than saying, you know, look, ULEZ, we have to do that. We have to do ULEZ and so much more.
In this episode, we've journeyed through the evolution of air pollution research and our understanding of its devastating impacts on human health. As Dr. Fuller outlined, what began with the catastrophic 1952 London smog has expanded into a sophisticated understanding of how air pollution affects us through our entire life. The research reveals troubling realities. Children in East London developing smaller lungs, historical exposure creating lifelong health consequences, and the recognition that there is no safe threshold for air pollution exposure. The World Health Organization's innovative approach to guidelines, setting targets at the 5th percentile of studies showing effects, provides an achievable pathway forward, yet governments continue to delay meaningful action. The promotion of wood burning as a supposedly green alternative reveals a dangerous contradiction. Not only is it devastating for air quality, but it's also harmful for climate goals when viewed in the proper time frame. As Dr. Fuller pointed out, it seems absolutely ridiculous that we're going to save the planet by burning trees. If you'd like to know more about the hidden dangers of air pollution, pick up Dr. Gary Fuller's book, The Invisible Killer, The Rising Global Threat of Air Pollution and How We Fight Back, a compelling look at how our world is shaped by the air we breathe. The EnviroHealth podcast is presented by Dr. Joseph Levermore and Dr. Steve Campbell. Our executive producer is ageThe. The EnviroHealth podcast explores the complex associations between our environment and human health, from air quality and water systems to climate patterns and urban design. Our environment shapes our health in countless ways, and we're here to help you understand these vital connections.